If the witnesses would stand and raise your right hand, please. Do you affirm that the testimony you are about to give before the committee will be the truth, the whole truth, and nothing but the truth? Thank you. Please be seated.
Thank you both for being here. Dr. Begg, I know you were born and raised in Connecticut, and you decided to go into medicine after your father passed away following a medical mistake. While studying at Johns Hopkins Hospital, you were voted the top resident, I understand, for community emergency room doctors. And during your residency there at Johns Hopkins, you also did a clerkship at the nationally recognized Maryland Shock Trauma Institute. And then you went to work at Fort Drum to oversee 800 doctors and 200 physicians' assistants at the Danbury Hospital. And you're currently president of the medical staff for the Danbury Hospital. I know you were in Newtown that day at the Danbury Hospital, where you were the ER physician on duty when some of the Sandy Hook children were brought to the hospital and to the emergency room. I thank you for your efforts on that tragic day and for testifying today. Thank you, Madam Chairman.
Chairman Feinstein, Senator Grassley, Senator Blumenthal, and members of the committee, thank you for the opportunity to speak and testify. My name is Bill Begg. I'm a board-certified emergency room doctor, and I trained at the Johns Hopkins Hospital. What's my inspiration for coming today? Well, I'm the parent of three Newtown students. I'm a grammar school track coach in Newtown. I'm with a couple grassroots organizations, including the United Physicians in Newtown and the Newtown Action Alliance. Our group of physicians, it's over 100 doctors in Newtown that all are on the same platform. Some are Republican, some are Democrat, but we all have the same platform about limiting assault rifles and gun violence. I'm the EMS medical director for Newtown that was in direct contact with all my providers in the field that day. I'm a friend to some of the families that lost loved ones. And I was an ER doctor that was on shift on December 14th. So what's my goal? What's my goal in the next 5 minutes? My goal is to somewhat convince you senators that banning assault rifles and real gun control measures that you will hopefully enact will make a difference. Okay, research since 1996 has been severely limited. I had to go overseas to look at some real data, some empirical data, to see what the real answers are. In Dunblane, Scotland, in 1996, a 43-year-old shooter got off 109 rounds. He killed 16 little children and their teacher, and he injured another 27 kids and 4 more teachers. In Australia, in the same year, a 28-year-old with an AR-15 assault rifle killed 35 people, and he injured another 23. The damage caused by an assault rifle compared to a regular gun is horrific, and many of those folks don't even show up in my ER because the injuries are so bad. There's nothing salvageable. They don't even make it to my ER. At the end, I have a video to show you. What did those legislators do across the world? In Australia, in the United Kingdom, they enacted real gun legislation. They banned assault weapons. Did the legislation work right away? No, actually it didn't work right away. It didn't, but where do they stand today in 2010? As far as mass murders go, in the U.S., we've had over 20 mass murders. In the United Kingdom, 1. In Australia, 0. Before 1996 in Australia, there were over a dozen mass murders in the previous 20 years. And as far as gun deaths and empiric data, we've had over 30,000 deaths each year in our country. In Australia and the United Kingdom, as of 2010, with their gun legislation and the ban of assault weapons, they have each less than 300 deaths a year. That's 1%. Gun legislation and ban assault rifles, it takes a lot to come to fruition, but it works. If you actually own a gun in your home because you think it's going to make you safer, let me give you some real stats. There's something called femicide, ladies getting killed. Okay, women are 5 times more likely to be killed by their spouse if there's a gun in the house. That's a real study. I'm sorry for for being loud, but this is emotional for me. If you own a gun in the house, you're 5 times as likely to die of suicide. And if you own a gun, you're 20 times as likely to die from unintentional gun death. Countries that ban assault rifles and have gun control measures do lower the chance of gun death for their citizens. In summary, what I'm asking you to consider is a ban on military-style assault weapons, a ban on high-capacity magazines, especially if they have more than 10 bullets, a ban on semi-automatic rifles, require background checks for all gun purchases, and please, can we do some real gun research in this country? In this country. What galls me is those who say, let's really focus on mental health, are the same ones who are saying, well, we need to have a conservative approach and balance the budget and cut programs. What are the first programs that are cut? Mental health. So what I'm asking you to do is not even add programs. I'm asking you just not even cut the mental health programs that are out there already. Allow me as a medical doctor, when I see a patient and I talk to them about the risks of excessive alcohol or tobacco use or safe sex, morbid obesity, seatbelts, texting and driving, can I please talk to them about the risk of gun violence? Please? There's a public service announcement right now that says you're 23 times more likely to die if you're texting and driving. Why can't I have a public service announcement saying the same relative to assault rifles and gun ownership? I'm not against the Second Amendment. If you go through the proper channels, I do respect your ability to own a gun, but not an assault rifle. I want to recognize the valiant efforts of the first responders from the greater Newtown area. Thank you for your service. And to the families whose loved ones actually made it to the ER, we all tried our best. To you lawmakers, my mom and my dad were both Connecticut state representatives, and I said to my mom, Mom, why don't you think, when it's so common sense to me, why don't you think they'll change? And they said, well, they have their party lines, and they have their lobbyists, and they may not be senior. And I said, well, do you think this one time they'll actually do what's right? She said, yeah, I think so. I think this time they will. People say that the overall number of assault weapon deaths is relatively small, but you know what? Please don't tell that to the people of Tucson or Aurora or Columbine or Virginia Tech, and don't tell that to the people of Newtown. This is a tipping point. And this is a public health issue. Please make the right decision. Thank you for your time, and if there's extra time, there is a small video on the difference between injuries there is the difference between a gunshot with a handgun and an assault rifle. But thank you for your time otherwise.
Thank you very much, Doctor.